Peace and freedom, grace be with you all. This is John Clifton with the Queens Libertarians. We are an independent libertarian organization, separate from the official Libertarian Committee representing Queens, but we are the oldest libertarian organization and the original county party chapter for this area, going back to the 90s. So I mentioned I was not feeling well last month. I'm well enough to be here today. I'm thankful for that. The other issue is that we have a situation where we were here originally when we first attended this location in this space, but we found it, I believe we found it better acoustically to be in the outdoor shed area, but the facility lost the license for that area. So we're going to be here for the time being. I also have just got clarification that RSVP is something that we should try to do each month, and that's particularly important in terms of the next couple of months. Next month, just to tell you what's coming up, we're going to have, well, it's tentative, but we're going to have a member or members of Urban Justice come here to discuss civil liberties issues and criminal justice issues relating to the new administration for mayor. Some people are concerned about which direction Eric Adams will go. Will he go in the direction of better law enforcement to deal with the crime issues here, or will it simply turn into more civil authoritarianism? A member, Dr. Luster, is going to speak on Russian foreign affairs and Russian domestic issues in June. So we have quite a slate already set up for us for the next couple of months. This month, our other doctor, Dr. Phil Shoenberg, is in attendance to lead a discussion or to bring a discussion, and he has researched regarding the issue of COVID vaccine. Separate from the issue necessarily of mandates for COVID vaccine and the situation that just started to happen in Canada with the truckers.
Oh, yes.
The question is of the day is, what is the validity of taking the COVID vaccine itself, separate from the other issues? And then we can bring back those other issues as qualifiers as we go along.
The title of my presentation is Lessons in the COVID Crisis, How We Can Do Better. First of all, I'd like to ask each of you to explain how has COVID-19 pandemic affected you. At the beginning of 2020, the British Prime Minister consulted the two greatest epidemiologists in all of Europe. He consulted Britain's own epidemiologist, Mr. Dr. PhD Dr. Neil Ferguson. He says, my best medical knowledge shows doom! A million Brits may die if we don't lock down. Scared to be Jesus on the Prime Minister, I can tell you that much. Then he consulted with medical doctor Anders Tegel of Sweden, the official state epidemiologist, and who works with the public health agency of Sweden. He said, just like PhD doctor, I've saved millions of lives. We have no data that lockdown will work. It will cause immense economic and psychological and sociological damage, collateral damage. I recommend space people apart, this social distancing, and we shouldn't have any meetings larger than 50 people. We may permit them when the situation improves. It says, I do not recommend the wearing of masks because we have no data. Well, nothing will work. Well, China was the first nation. Well, let's see who was correct. When they asked Dr. Edward Segal, said, let's see the year who had the better idea. Before the pandemic, I'm going to speak about 13 lessons. Before the crisis, plan how to work together. Benjamin Franklin once wrote in Poor Richard's Almanac, an ounce of prevention is worth more than a pound of cure. Step number 1, be aware. Edgar Allan Poe, in his 1842 short story, The Mask of the Red Death, in which implementing a quarantine did not work, began the long literary and cinematic tradition predicting doomsday by pandemic. Numerous documentaries, histories, and novels have revisited the Spanish flu epidemic in 1918-1919, or dramatized future epidemics as science fiction possibilities or as horror stories.
7 up.
Step number 2, anticipate. President George W. Bush decided to be preemptive by fighting pandemics abroad instead of waiting for them to come to America. In a preceding speech, he warned, scientists and doctors cannot tell us when and where the next pandemic will strike, or how severe it will be, but most agree at some point we are likely to face another pandemic. Our country has been given fair warning of this danger of homeland and time to prepare. In 2006, Bush awarded the Presidential Medal of Freedom for Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases and the Chief Medical Advisor to the President, for his role in the President Initiative and countering AIDS, HIV in Africa, saved millions of lives. Step number 3, have an emergency plan in place. In 2014, the media screamed, we are doomed by Ebola because it encompassed the President Barack Obama. Responding to this criticism, Obama put Rob Clay in charge. He got the health bureaucrats to fight Ebola in Africa instead of fighting each other. Then Ron Clayton and his team wrote a 69-page playbook for high-consequence emerging infectious diseases, threats, and biological incidents. The future administrations to follow. To implement the playbook, because Obama created the Director for Global Health, Security, and Biodefense to contain future pandemics, as well as an early warning system agent abroad in pandemic hotspots. The playbook and the agency aim to coordinate response to various federal agencies and the cabinet departments. Today, Ron Clinton is Joe Biden's chief of staff. Step number 4. As too happened once in a crisis or an emergency passes, bureaucrats and politicians decide to save money instead of planning ahead. As a result, the stockpile of PPEs, ventilators, and other medical equipment and supplies recommended for emergencies were underfunded at both the federal and state levels. Despite pleas by Obama's Ebola coordinator Ron Klain and Trump's own Secretary of Health and Human Services, Al Gazar, the administration in New York State Governor Andrew Cuomo developed a triage plan to deal with forthcoming epidemics instead of using political capital to get the necessary funding for supplies. In The Wealth of Nations, published in 1776, Adam Smith explained how free trade benefited all nations in which they specialized in what they could do best at the lowest prices and traded with each other for what they needed except for national defense. Is neither self-sufficient in military nor health supplies which puts our national security, health, and welfare at the mercy of other nations. During the corona epidemic, it was every nation for itself. Step number 5. The plan, the agency early warning system set up by the Obama administration were eliminated. On the words of John Bolton, Trump's security advisor, to save money and to fight the deep state. As a result, the Trump administration blinded itself so that everybody was flying blind. Trust but verified, a Russian proverb quoted by President Ronald Reagan should be heeded by President Obama. Like being Sanger in his 2021 book, Snake Oil, how Xi Jinping shut down the world, documents how the People's Republic of China mishandled the COVID-19 crisis from day one. The nature of China's totalitarian model, political model, does not allow for freedom of thought and a challenge to the system. In November 2019, when a doctor tried to first alert the Chinese authorities about the outbreak of COVID-19, he was arrested and eventually died from the disease. The Communist authorities viewed the outbreak as a political challenge to their system of government, to be concealed from the world, not a health crisis to invite global cooperation to stop it. In January 2020, the Chinese Communists deliberately misled Dr. Tedros Adhanom Ghebreyesus, the director of the World Health Organization, and Dr. Anthony Fauci, the President's chief medical advisor. Neither were communist tools nor fools, but they failed to realize that their colleagues put ideology and politics ahead of health and medicine. Xi Jinping, China's easily outfoxed Trump, foolishly took his word that everything was under control. Trump emerges as the greatest villain in this crisis because his failure to implement the first 6 steps, as we shall see, for politicizing this crisis. But he's also the greatest hero in this piece, as I shall explain. Step number 7, avoid politicization. Donald Trump, an anti-vax have long standing, dismissed the outbreak of the pandemic as nothing. Instead, he politicized the pandemic by making it the responsibility of the states to handle it each in their own way to compete against each other for scarce supplies, which Governor Cuomo called nuts. Mark Meadows, Trump's White House chief of staff, in April 2020 spent more time in staff meetings with the state administration response through what had become a public health, economic, and political disaster by scapegoating state governments than finding ventilators, personal protective equipment, and test kits. The ultimate goal was to shift responsibility to lead the fight against the pandemic from the White House to the states. They refer to this as a state authority. Trump and his staff continuously remained optimistic that the outbreak was fading. The state governments had all they needed, and it was time to ease up on the lockdown. President Trump, who in the interview once said, "I bet it myself," made a very bad bet. Trump sabotaged federal and state efforts against the disease by spewing misinformation, mocking masks and social distancing, championing freedom from vaccination and liberation from any efforts to contain the virus. No precautions were taken against COVID-19 at Trump's campaign rallies, except to get lawyers to sign a legal waiver. And Donald Trump himself was a very bad patient. He was spread COVID-19 for days until he was tested for October 2nd, infecting at least 40 White House staffers. Surely a memorable gift from the head of state. Step number 8. Know how to lead, delegate, and by utilizing the appropriate experts for licensed assistance. Like everything else he did as president, Trump preferred to rely on his gut, seeking the advice of experts and professionals. Trump and anti-vaxxer seem to have regarded COVID-19 as a human opponent trying to grab the limelight away from him, that he could talk to death. The medical experts at full part of the White House presented how to correct Trump after each press conference. The treatments he recommended would harm and kill people. Trump was not the only politician who decided to play doctor. Democratic Governor Andrew Cuomo in New York condemned over 10,000 senior citizens to death by ordering nursing homes to accept COVID-19 patients when New York State hospitals were overflowed. Step number 9. Have a system in place that can rapidly develop vaccines. Despite all his faults and mistakes, Trump has never received proper credit for his greatest achievement, the rapid development of a vaccine, because he did not crow enough about it. Dr. Peter Marks, the director of the Center for Biologics Evaluation and Research within the Food and Drug Administration, suggested Operation Warp Speed. Step number 9, have a system in place that can rapidly develop vaccines. Despite all his faults and mistakes, Trump never received proper credit for his greatest achievement, the rapid development of a vaccine, because he got crow enough about it. Dr. Peter Marks, the director of the Center for Biologic Evaluation and Research within the Food and Drug Administration, suggested Operation Warp Speed, named after his favorite TV show Star Trek. The rapid development of a vaccine with minimal bureaucratic roadblocks. Secretary of Health and Human Services, Alice Azar, has been an excellent leader in both the private and public sectors, by the President to approve and fund the plan. Trump periodically recommended people get the life-saving shots once they were available. On September 16, 2020, the Trump administration released a plan developed by HHS. By December 31st, Trump declared that he had met the deadline to roll out the vaccines in January 2021. The vaccine being rolled out in January 2021, he and his wife, Melania, were quietly vaccinated at the White House, but other officials made a public spectacle, such as incoming President Joe Biden, Vice President Kamala Harris, and Vice President Mike Pence. Step number 10. Know how to gain the public trust by communicating in a non-threatening and timely fashion. Public communication was a disaster from the get-go for 4 reasons. Firstly, the scientific and medical communities failed to educate people on the germ theories of diseases and their prevention. Secondly, the scientists and doctors showed institutional distrust in the expertise because they are willing to admit they do very little, so they guess in the absence of data. Dr. Vinay Prasad wrote, the CDC cannot follow the science because there is no relevant science. Thirdly, the media distorted, hyped, misinformed, politicized the pandemic that doomed us all. Initially, both CNN on the left and Fox on the right gave reasonable, accurate accounts, but they politicized in different directions that scare their audiences. Although Fox newscasters were vaxxed per company policy, Fox News became the network of the anti-vaxxers. CNN demonized Trump and behind the scenes advised Governor Cuomo how to become a media darling. He won an Emmy for his news briefings. CNN never mentioned 10,000 senior citizens who died on his watch in New York State. And the Wall Street Journal said that Governor Cuomo was the worst leader of all the 50 states. Fourthly, anti-vaxxers, conspiracy theorists had a field day. and spreading conspiracies, rumors, and lies about COVID-19 and security. The federal agency investigated did not work. On May 11, 2020, under oath, Dr. Fauci denied Republican Senator Ron Paul, a medical doctor, accusation of NIH funding in China to weaponize the coronavirus. He has spent his medical career saving lives, saving millions of lives. Step number 11, be able to test effectively in a timely fashion. On January 19, 2020, both South Korea and the USA reported the first COVID cases in their countries pursued different strategies to contain it. South Korean government asked its clinical laboratories and pharmaceutical manufacturers to come to the rescue. In less than 3 weeks, the South Korean government had approved 60 different tests from the private sector. That South Korea also implemented a uniform text-based schedule system to enable everyone to get tested rapidly and be informed of the results in a timely fashion. Time was further lost when contaminated DC kits were found to had to be replaced because they were contaminated. By March 2020, it was too late for the U.S. to implement the test and trace strategy in favor because there was too many patients and not enough test kits. Trump famously tweeted on October 26, 2020, "Cases up because we test. A fake news media conspiracy." As always, Dr. Anthony Fauci, the chief medical advisor, had to correct Trump. If we did as Trump recommended, ignorance would be bliss. Approach number 6. Quarantine. People tested positive stay home. South Korea, Taiwan, and even Hong Kong, with past experience with pandemics, instituted test measures quickly so that a few carriers were quickly traced and quarantined with a limited number of tests available. Approach number 7, isolation, means the patient has serious symptoms. So he's put in the hospital so as not to spread the disease, and the medical personnel wear protective equipment. Approach number 8, curfew. People are ordered indoors at specified times. Anecdotes from the Spanish flu of 1918-1919 as well as the current pandemic indicate that this does not work because people suffer from cabin fever and need to get out and to socialize. Riots occurred in New York City, as well as the rest of America and around the world against curfew. Also protests. Approach number 9. Lockdown enforced by the government stops the movement of people. Stay at home except to go to an essential job or shop for essential needs in the hope of limiting the spread of the outbreak. Prior to COVID-19, a lockdown was not part of any country's pandemic playbook. Totalitarian China is the first country in the world to implement a nationwide lockdown. On January 23, 2020, more than 50 million people were locked down in the Wuhan City area, but it was too late because hundreds of millions of Chinese were on the move during China's biggest holiday, the New Year. China still remains a nation in lockdown, entering the 3rd year. If you look at the Olympic Stadium, the seats are empty, testifying how effective this has been. On March 19, 2020, California became the first American state to impose a mandate or lockdown, a mandate lockdown. By April 1st, 2020, most Western countries were mandating lockdowns but not support. Approach number 10, living with the disease. On January 31st, 2019, when Sweden had its first COVID-19 case, its pandemic strategy is to live with the disease by trusting the public to act responsibly, by informing the people about the right things to do, instead of imposing wide-ranging bans, mandates, and restrictions. Swedish Prime Minister Stefan Löfven said it was common sense to follow Dr. Anders Dr. Technell's strategy. Because of a long tradition of respecting free will, as well as a high level of trust and respect the Swedes have for public authorities. The Swedish authorities advise people to maintain good hand hygiene, work from home if possible, and practice social distancing. While those over age 70 were urged to self-isolate as a precaution. Gatherings of more than 50 people were periodically banned and lifted as the health situation changed. Schools and universities disregarded recommendations to close down so the students did not lose a year, as students did in America, of learning. Although Technell was skeptical about face masks, Sweden began recommending face masks on public transit in December 2020. As Stockholm's healthcare system became seriously overwhelmed for a brief period of time. The borders of Sweden were closed against Dr. Technell's advice. In fact, this would not stop the march of the disease. Swedes had neither mandate nor COVID passports, but they had their freedoms. Well, distrust against the politicals and medicals around the world have increased in the country that locked down. Trust in the Swedes that the government and medical establishment increased. Dr. Anders Tegnell became a folk hero, with people getting his image tattooed and buying T-shirts with and handbooks with his image on them. Approach number 11. Get vaccinated. Social gatherings in his office as Prime Minister. The politicians in America know better. Democratic Congresswoman Alexander Ocasio-Cortez in New York denounced Republican Governor Ron DeSantis for ending gold mandates in Florida. No COVID passports. No masks. No requirements for the restaurants. Guess where she decided on vacation? Miami! No masks, no social distancing, having a great time. Scores of Democratic mayors, governors, legislators have advocated rules for thee, but not for me. When in court, they think a simple apology is enough, and the public will forgive her again. We have 3 questions to ask. First, why did we panic over COVID-19 and did not do that with other pandemics? Secondly, why did the nation's world adopt this unproven, untried method without any data? Why was there no public discussion before it was implemented? Why did liberal democracy so seriously imitate the Chinese totalitarian model? Third, is the lockdown the way to go?